Welcome to the Medicare Show. I'm your host, Jeffrey Kuhn, your Medicare advisor. This morning, it's about mid-September, I'm going to be reviewing Excellus' annual notice of change for Medicare's Blue Choice Extra plan in the Rochester network area, which includes Rochester and the surrounding counties. We get more questions on the annual notice of change. A lot of people don't understand what it is and what they're supposed to do with it, or don't even look at it. And in this episode, I'm going to go over one really critical item I found in here that is actually, I think, a mistake. Well, actually, I know it's a mistake. So I'm going to share that with you and go over some of the important changes with the extra plan that Excellus has to offer for 2025. This has probably been one of the most popular plans in 24. And certainly leading into 25, I have a feeling that this is going to be, clients that are in have been pretty happy and probably looking to continue it, and many more possibly moving into it, especially with the discontinuation of one of the Medicare Advantage plans they offer. So if you have this annual notice of change, or you're curious what the Medicare Blue Choice Extra plan is by Excellus, you've got to the right podcast. I'm going to start going through this and just sharing some critical information in here that most people don't pay a lot of attention to with these. And it's the most important thing you get in September. It tells you everything you need to know about your plan. And you got to determine, what are you using in this plan? How has it worked for you for the last year? And does it fit with what you're typically using? So if you have the annual notice of change, the first thing I'm going to ask you to do is take a look and notice some of the information that they have on here. You can just, and if you're happy with the plan, you just leave it and it rolls over for the next year. If you go down on the second page, they'll give you some information about this and, the options that you have with the plan. But one of the most important things I've noticed in here, and it caught my eye, and I did check the other plans, and it's the same exact language is in there, about Medicare Blue Choice Extra HMO. The very last paragraph on the second page of the document. It's not the numbered pages of the annual notice of change, but it's in all the disclosure. I'm going to read this to you. And I'm going to tell you right now that this is not correct. And I think that people that actually read this would be a bit concerned about it. And what tells me is not a lot of people read these documents, because I've not gotten many calls about it. But when I review this with clients, this is going to come up. The very last paragraph starts off with, this plan does not include Medicare Part D prescription drug coverage, and you cannot be enrolled in a separate Medicare Part D prescription drug plan and this plan at the same time. Now, this plan does have Part D with it, drug coverage included. What you might see if this was the case, that this does not, it would be an MA-only plan. MAPD means Medicare Advantage prescription drug coverage. It's also called Part C, which means it includes Part D. So when Excellus put this out, I think they made an error, and it is on the other plans. This plan does have drug coverage built into it. So if you happen to see this and notice that it says it does not include Medicare Part D, that is absolutely incorrect, 100%. So that's a mistake in this. I can't believe that that's actually in there. The first page of the annual notice of change is kind of a summary. It's the most commonly used things that people will use or look for. And some of this is most significant changes they'll put in here first. So I'm going to go over some of these, and I'm going to go into this annual notice of change, some other important information you want to look at. So page 1, you can see first and foremost, what is the premium going to be? So for 24, it's $0, and 25, it's going to be $0. A lot of people have really enjoyed a premium reduction for their Medicare Part B premium. In 2024, they were getting a $31 credit back towards their Part B premium. So folks collecting Social Security, you saw an increase in your check. They are going to reduce that next year to about $26. The thing you have to keep in mind is, with the Inflation Reduction Act and the decreased funding that Medicare is providing, insurance companies are making some cutbacks and trying to cover some costs. This is one of the areas that's pretty common, and some of the carriers have gotten rid of those plans altogether that were doing the Part B Get Back. Now, the max out of pocket, this is the most you're going to pay out of pocket for covered Part A and Part B services, which is a medical. Does not include your prescriptions, and I'm going to get into that a little bit later in this podcast. But for 2024, your max exposure was $7,900 as your max out of pocket. They are going to increase that next year to $9,300. So it's a pretty steep increase. However, in New York State, we do have guaranteed issue, and we are able, under certain circumstances, to move folks once a year should you get a diagnosis or something should happen. Now, we typically don't ever have clients that hit this out-of-pocket max because I've always said if you've got a change in your medical condition or something happens more chronic, pick up the phone and give me a call. Let's figure out, make sure you're in the right plan so that doesn't happen. Now, your doctor office visits, your primary care visits. Now, your preventive is always included, which in this plan includes a physical, and other preventive services are always covered. But anytime you see your primary care doctor after that, in 24 you paid a $10 copay. And next year they're going to keep that the same at $10. Specialist visits is a $50 copay, and again, that's going to stay the same for 25. Now, inpatient hospital stays. Rarely does this happen. I always tell our clients most of the time it's outpatient, it's observation, so you want to be careful and pay attention to this, but don't get concerned. Most often, even if you're held overnight, it's done as an outpatient ambulatory procedure. So inpatient hospital is $400 a day for the first 5 days. That means you're admitted. You're fully admitted into the hospital. Next year, it's going to go up to $475 a day for 5 days. A lot of the companies are the same. Now, there are some carriers we've seen that have extended this out 6 days. They've gone a little bit longer, but I wouldn't be overly concerned about it. On page 2, prescription drug coverage. Now, keep in mind Medicare's standard benefit, which insurance companies can't go get worse than this, but they can offer better benefits. The standard benefit in 2025, and this is primarily due to the Inflation Reduction Act, is a $590 deductible. You pay 25% of your drug costs until you've paid about $2,000 out of pocket. That's the base benefit. Now, with these plans, you typically see a little bit better benefits in most of the areas. This plan for next year has a deductible for tiers 3 and higher of $400, and that is the same for 24 to 25. It's a $400 deductible, and depending what formulary your prescriptions are in, you could pay 0 for your tier 1s, you're going to pay 15 for your tier 2s for your preferred pharmacies. It might be a little bit higher for your standard pharmacies. Then your tier 3, you're subject to the deductible and slightly higher copay. So when we look at your tier 3s, you're looking at about $42 copay. And we typically recommend folks, if you've got the ability to get 90 days, it's usually cheaper. They'll give you 1 month free. So you're really paying 2 copays to get 3 months worth. Insulins, they've had the insulin saver programs with most of these carriers now for a few years. Really has nothing to do with the Inflation Reduction Act, except possibly it's law. But with a competitive markets, pretty much every insurance company has followed suit with this. $30 copays for your insulin. It's going to stay the same next year with this plan with your preferred pharmacy, standard pharmacy, and in this plan, CVS right now is the only one that is standard. Everybody else is preferred, and it's a $35 copay if you happen to go non-preferred with this. And then your tier 4s, they're going from a 21% coinsurance up to 50% coinsurance. So that's a little bit more of a change. But again, it's a $2,000 out-of-pocket max for the year for your prescriptions. And then tier 5s are going up just a little bit, from 27% to 28%, but very few people are on tier 5s. In that annual change, and that goes through pretty much the first 4 pages with a summary. Then you've got another index here, which talks about the different sections of the plan. And there is some important information. I think some people will just skim over the very first. But when you look in this, it has a lot of the same information, but it has all the changes. And there's some really good information in here. Ambulance, it's going from a $260 copay to $275. That includes air ambulance. Your ambulatory surgery centers, $380 in 24 to $400 in 25. Chiropractic care is going from a $10 copay to $15. Then colonoscopy diagnostic is going from $380 to $400. And there's some other things in here. Emergency room copays are going from $100 to $110. One thing that, people always ask, and it's really important, actually there's a couple things. First, eyewear. You do get an allowance every year. In 24, it's a $125 allowance. Now in 25, it's going to actually double to $250 allowance for eyewear, and that's really good. One of the rollout meetings and the conversations I had with Excellus is they are changing from people who are used to hearing the words, and I always ask, silver sneakers, do I get silver sneakers? That's the old term and plan that where you've got these plans you can go to the gym. With Excellus, typically you can only go to one gym and they have a free membership there. It's been called Silver and Fit. There's no co-payment for that for the participating facilities. Next year, they're changing the name to Fit On. And my understanding is what I was told is that you can belong to more than one gym and go. And they've got a lot more facilities. It's a better program. So if you see Fit On, don't be concerned. And I've seen this happen with other carriers. They've changed the fitness program provider and it actually got better. But if you got general questions about it, they do have a phone number you can call on here, Fit On Health. It's toll free. It's 855-952-6423. So feel free to call that. Looking, and I'm going to continue with this a little bit and just scan some things in here and going through the pages to see, okay, what is it here that you want to know? Page 9, observation stays. This is how most things are done at the hospital. We have people that, right now have horror stories about sitting in the emergency room. And typically when you're in the hospital, you get put in observation. They love to do that usually for up to 3 days. There is a co-payment for that of $380. It's going to go up to $400 next year. It's not bad. One of the benefits, and a lot of people don't take advantage of this, is the over-the-counter credits you get. So in 24, you had a $30 allowance per quarter for over-the-counter health-related items like vitamins, sunscreen, pain relievers, cough, cold medicine, bandages. You can get COVID-19 testing kits. There's a whole list of things you can get. Most people will just call and order directly with them, and they'll mail it to you. That's $30 a quarter. Next year, they're actually going to increase that to $50 per quarter. It's really good. Continuing on, again, surgical care outpatient hospital is typically the same as outpatient. Looking here, the co-payments are the same. $380 for this year, going up to $400 next year. And in urgent care worldwide is $55 currently. It's going to go down to $45 for next year, which is pretty good. So they've got some other disclosures in here, changes with the drug list, yearly deductibles, important dates to know about Medicare, and the annual election period, coverage gap, and then the payment program, which, again, you can spread out your prescription costs over 12 months. So take a look at this. This is, again, I can't stress enough how important this document is to understanding what's happening with your plan. Nobody likes surprises. If you do nothing and your plan gets terminated, you go back to original Medicare with no drug coverage. That's going to be a big surprise. That means you're subject to deductible on all your Part B expenses, and you also are responsible for 20% of all your costs. And you don't have drug coverage. So one other item I'm going to share with you real quick, because we get this call all the time. When do I get my cards? So if you happen to change plans, or let's say you're looking for a new card, what their plan is for 2025, new member cards, they're going to be mailed in mid-December. And they said if you don't receive your ID card by 12/31/24, please contact their customer care department. So keep that in mind. You don't get the cards right away. You'll get them towards the end of the month. They typically run them all together, so it's less costly to do that for new member cards. So they will get those to you. Typically, it's a 2-week process. If folks are new to Medicare, it's middle of the year. Once you apply, you'll get an award letter from the insurance company, and then usually about a week later, you'll get your cards as well. And keep in mind the Medicare prescription payment plan. That's going to be facilitated through your pharmacy with your insurance. So ask about that in the beginning of next year. So hopefully this was helpful. You enjoyed the podcast. Please subscribe to it, share it. If you know somebody else that would benefit from it, we're going to have other annual notices of change discussions. I'm going to do another one here shortly on another Excellus plan, and we'll probably lead into a United Healthcare after that. Thank you for joining me. Bye-bye.